Somebody who could have just benefited from a simple procedure now may be needing to get radiation or chemotherapy, or their condition may no longer be curable. My name is Dr. Olga Swanson. I'm from Houston, Texas, and my practice is in the general Houston area, and I practice gynecology. The Houston community is suffering terribly from the economic hardships resulting from the furlough and unemployment. So we're seeing a lot of patients, unfortunately, losing health coverage, and hence they're unable to follow through with treatment and things of that nature. Patients that have perhaps come back with abnormal cytology, so abnormal pap smears prior to the lockdown, are sometimes unable to follow through with their biopsies and hence getting delay of diagnosis. Same with things like breast masses in particular. We'd ideally like the patient seen and treated, or at least biopsied, in a very timely fashion within a week or so. If they've had to wait 2, 3, 4 months for this kind of care, somebody who could have just benefited from a simple procedure now may be needing to get radiation or chemotherapy, or their condition may no longer be curable. So I was personally a patient that was inadvertently affected by this. And it wasn't a breast mass in my situation. In my situation, it was an ear infection. And I contacted an ENT, an ear, nose, throat specialist. I was unable to get an in-person appointment. So I was asked to see somebody via a telemedicine appointment. Unfortunately for me, I was misdiagnosed and my condition worsened. I tried to contact said physician requesting an in-person appointment when my pain was getting significantly worse and not responding to the prescribed medication. I was instructed that the office was unable to see inpatient appointments. So after calling 7 different ear, nose, and throat specialists, I was finally able to get an appointment, and I've ended up being on 7 different antibiotics to treat this. Eventually ended up with an eardrum rupture, and now will likely need surgery to fix this. So in my personal opinion, we certainly should not think that all other health concerns will just go by the wayside.